5.
Yeah, you're 5.
Yeah, 5.
Senator Rasmusson, I think we have 5 people here. Doesn't that constitute something in your book? A quorum, I believe. Yeah, that's good. Welcome. It is Wednesday, March 5th, 2025, the Minnesota Senate Human Services Committee. Real quickly, thank you, Ms. Graham, for coming just to update the committee. And we asked about some contingency, what's going on. Just maybe give us a little 30-second update, and we can go through the rest of the motions and stuff. So, Ms. Graham, thank you for being here.
Thank you, Mr. Chair. For the record, my name is Christy Graham. I'm with the Department of Human Services, and thanks for having me, Chair Hoffman, here to provide a quick update, as you mentioned, on a potential service disruption for a large substance use disorder treatment program provider in the state of Minnesota. They provide services across Minnesota, both in rural areas of the state as well as in the metro. A lot of the information related to this closure is confidential under the Minnesota Government Data Practices Act, so I can't provide tons of details here today, but we can confirm definitely that there is an investigation ongoing regarding New Way. And as you all know, SUD is a critical need. Substance use disorder treatment is a critical need in the state. And it's really important to us that we make sure that people have access to those services as well as the associated housing. Most of the providers in the state are doing a great job. They're in compliance. They're following the laws. So I don't want to underemphasize that we have a lot of great providers across the state. But as noted in the Minnesota Attorney General's February 15th court filing, DHS has issued a payment withhold for New Way, and that was issued over a year ago in February of last year. We've extended that deadline to implement the payment withhold several times over the course of the past year, really trying to make sure that we can avoid service disruptions. And you'll see in the court filings that the reason that DHS issued that payment withhold is because there are credible allegations of fraud for that provider. So the allegations specifically were that there was billing that was provided but not actually, that was billed but not actually provided services, improperly induced services through the use of legal kickbacks, failed to return overpayments, submitted claims for which it was not entitled to reimbursement, and failed documentation in compliance with legal requirements. For any licensed SUD provider in Minnesota, if there is a closure, the provider does have to provide us with 25 days notice and make plans to transition clients to other supports and services. To date, we have not received a notice from this provider. But we have been working over the past year with both our state and county partners to make sure that we're gathering resources and preparing for coordination if there is a closure. We've had a complex project team in place at DHS. We've got representation from our housing parts of the department, behavioral health, our licensing areas, our Office of Inspector General, and we've been working together to make sure that we've got all the resources and the connections established in case something were to happen with this program and they were to close. Some of the people at these programs have corrections case managers, and that makes things a little bit easier for transition. So they are able to, in our experience, help people get to new housing and to new services rather quickly. But as it stands today, New Way still does have an active license. They're still serving people. We know that they have about 715 individuals. We just got an update from them today that could be impacted if they were to close. Again, that hasn't happened. And at DHS, we've been conducting meetings with individual counties, so Ramsey, Hennepin, Blue Earth, Stearns County, Anoka, and St. Louis. Between February 10th and 18th, we held individual meetings with each county to make sure they understood where the programs are in those counties and what kinds of resources people might need if a closure is to happen. We've been working really closely at DHS with the Office of Addiction and Recovery to conduct all of this planning. We are hoping to bring together and convene housing providers and SUD providers in the coming week to make sure that people understand and have access to the most current information and that we can support people as needed. So I think kind of the bottom line here is, like all providers, New Way does have to follow state and federal laws in order to bill for Medicaid. In the past year, they've had numerous opportunities to change their business model, to come into compliance. That has been all of our goals, is to make sure that the laws are being followed and that people have access to these services. So we are deeply concerned about the potential impact on not just people, but also staff at those programs. And I will just lastly highlight that DHS and the governor has really been on the forefront of making sure that we're addressing recovery housing over the past few years. We had proposals in 2023. We also have a few proposals this year in the 2025 session that we hope to work with many of you on. So we've got a proposal that would prohibit duplicative billing, which is something that you may have seen in the court filings related to this provider. We have a proposal that would make sure that people can get access to recovery housing regardless of their status and treatment. We have a proposal that would change the billable units for outpatient services, so reducing the units from 1 hour to 15 minutes to really customize the services and to make sure that there's transparency in the services that are being provided. And then just making sure finally that in recovery residences, there are protections for people, that those settings are held to a higher a standard of some sort, and obtain a certification if they're using public dollars. So, Mr. Chair, that's the quick update. Probably went over 30 seconds, but wanted to make sure I touched on a few points.
I'm glad you did, Christy. Thank you, Ms. Crom. That's the questions that we were asking. Given the fact that this is going to happen, what's the contingency? Sounds like you have a team in place, and it sounds like, but you have not, my understanding is you have not received notice yet from the provider. So I appreciate you updating. Members, you want to follow up? Senator Utke.
Thank you, Mr. Chair. And this goes even beyond just this particular case, because we deal with lots of organizations through all the things we do. But one of the items you missed, and you have a whole laundry list of things that are been challenges with this group, but I saw in there, I'm reading the what's coming across, but it's what you had said was it failed to return overpayments. Do you not have the ability to claw back? I'm thinking that should be something you never have to deal with, because if you do make a mistake, you've got a chance to communicate, claw that back on the next payment, and everything's squared up. And so that was just something that kind of goes across the whole gamut of the business you do.
That's a great question, Senator Utke. Thank you, Ms. Crom.
Chair Huffman, Senator Utke, you're right, and I'm referencing specific things that were cited in the legal documents, and sometimes those might be different than what our authority is. I'd have to get back to you on that specific instance, and we might have to refer you to the court documents, but we do have the ability to recover Medicaid funds through a monetary recovery statute. You're correct. So we can get back to you with some specifics.
Thank you, Mr. Chair. And yeah, that's what I was after. I mean, this is a separate case on its own, but just making sure you have that ability and you're able to do and are doing that, because you handle a lot of money and there can be mistakes, but you have the ability to work the correction back through the system. So thank you.
So, Senator Utke, that's in the other body. Representative Baker had been asking that same question. Maybe, Ms. Crom, if you can give us just an update in the future just on what options are available to what Senator Utke is putting in there, is how do you reconcile that piece that's there? Because there's also another entity last year. Do you remember that? That same thing is, how do you reconcile that piece as well? So I would appreciate what options exist from that we should be aware of. So thank you. Nobody else? Senator, thank you so much, Christy. Senator Frentz from Blue Earth County Long-Term Residential Facility Supplemental Housing Support Rate Establishment. Come on up with Karen Klabundi from Welcome Manor. Well, welcome to the Senate. Welcome to Human Services.
Thank you, Mr. Chair. Vice
Good
Chair
Senator from Maye Quade.
and members. Very proud to bring to you Senate File 1139. If substance use disorder is a topic, I think you'll find this worth listening to. I have with me Karen Klabundi. Members, what this does is essentially gives permission to change the supplemental rate. The significance of the facility is that it treats up to 20 women at a time, women who can bring their children with them. So this is a different capacity than some of the substance use disorder facilities. And as you might expect, has some challenges, which I'm going to let my testifier talk about. The bill itself simply says that county agencies shall negotiate a supplementary rate up to not to exceed $750 per month. I know $750 is not a lot of money, but that might save a life. And so with that, I'll have Ms. Klabundi testify. Thank you, Mr. Chair and members.
Senator from Mankato, thank you very much. Ms. Klabundi, for the record, state your name.
Thank you, Mr. Chair and members. My name is Karen Klabundi, and for the last 12 years, I've been the director at Welcome Manor Family Services, a residential treatment facility located in Blue Earth County, just outside the city of Mankato. We have been providing short-term addiction treatment services to women since 2007. Last February, our previous owners decided retirement sounded pretty good, and they decided to contact Minnesota Adult and Teen Challenge. MNTC stepped up to purchase the facility, and so our critically important work could continue. We are requesting a higher residential housing support rate for 20 of the beds in our facility so we can fulfill the long-term services that are desperately needed. Treatment services, housing, food, everything, as you know, has gotten more expensive. We want to ensure that we can provide the best care for our women and children. While we found children can often be a driving factor for a mother to achieve and maintain sobriety, they can also be a barrier to treatment. There are very few treatment facilities in Minnesota that specifically serve women, and even fewer that have the ability to serve pregnant and parenting women with young children ages 0 to 5. I'm happy to say Welcome Manor is one of those few. So let me share with you some information about Welcome Manor and who we serve. We have an on-site daycare that can accommodate up to 41 children, while we provide services to 53 women at any given time. We serve approximately 150 women and 220 children in a year. In addition to substance abuse disorder, 87% of our women come with a known co-occurring mental health disorder. Sadly, only 49% of our women who admit to our program can say they came from stable housing. Our average length of stay is 3.5 months for women with children and only about 60 days for women residing with us without children. This means as soon as a woman enters our treatment, we start planning for her discharge. And one of the first steps is planning to find stable housing before her funding runs out. It's a constant race, and we often don't win the race. Let me briefly share with you a recent example of why this housing support rate adjustment is so important to our continuing work. Less than a month ago, we had a client, and I'll call her Lisa. She came to us and was with us for almost 30 days when her funding ran out. After several weeks of us trying to secure her funding, we had no luck, and so Lisa was discharged. At that time, Lisa knew, and we knew, she was not ready. A week went by, and then she started her drinking. Another week went by, and then she reached out to Welcome Manor. She wanted to come back to us. She reported that she had begun drinking and was up to drinking 1 liter of alcohol a day. She reached out to us because she was crying for help and felt like if she didn't get that help, she would die. That was 2 days ago. I would go on telling you many stories about the Lisas who were discharged from Welcome Manor before they were ready. I could also tell you about the less fortunate ones that didn't make that call and resulted in a tragic ending. However, we don't have the time for that today to tell all those stories. So I'll wrap up my time by simply asking you to think about all the Lisas in Minnesota needing help and to consider how many lives could be saved by approving the residential housing support rate. Thank you.
Thank you, Ms. Klabundi. Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Senator Frentz, for bringing this bill and for highlighting this really important work. And I think we need to make sure that we're supporting high-quality providers within this space. And this is clearly a high-quality provider that is serving a very underserved population. And I've heard about these challenges across the state, and I know that a facility like this, while it might be located in Blue Earth County, will really serve Minnesotans from across the state who are in need of this kind of care and services. I had a similar bill last biennium for basically the same rate mechanism in Douglas County and also in Crow Wing County. And even though they're located close to the area I represent, they serve Minnesotans from all over the state. And for me, it's worth the investment if we can increase the success for individuals who are going through these programs, help their families, and so just really appreciate bringing the bill forward today. Thank you, Mr. Chair.
Thank you, Senator Rasmussen. Senator I'm just EMQ, Aaron Maye Quade. Look I'm just sitting here, because I'm asking, I thought you had a bill that was, because there's another gap, this is one gap, but there's another gap about moms in treatment. And I thought, and my head's spinning, you know what I'm talking about? Go ahead, EMQ.
Thank you, Senator Hoffman. Yes, I have many bills, some that are related to substance use disorder and pregnant Minnesotans. Yes. I just had a quick question, and thank you so much for being here, and thank you for the bill, Senator Frentz. Is this program at Welcome Manor, is this long-term recovery program, or is this your licensed treatment program?
Ms. Klabundi.
Thank you, Mr. Chair and Senator. We are requesting this for long-term treatment. We are currently a short-term treatment program.
Senator.
Thank you, Mr. Chair. And just so I'm clear, is Welcome Manor, it was acquired by Adult and Teen Challenge of Minnesota?
Ms. Klabundi. Yes, the answer is yes. It's the Minnesota Adult Teen Challenge. It's different from the other ones. We've had, like last year, we had this conversation. We're like,
Yes. Thank you, Mr. Chair.
Yep.
And so I think just, one thing to know is that, so this is a faith-based program.
Yes.
Christians are required to participate in Christian-based programming in order to participate. That's what it says on the website.
Yeah, that's what it says. But you know, it's funny. I think we've just Ms. Klabundi, can you help us understand? Help us understand how that is something that isn't necessarily accurate in the website piece. If you could help us understand, that would be great.
Sure. Mr. Chair, Senator, Welcome Manor was recently acquired by Minnesota Adult and Teen Challenge, and they are known as a faith-based program for their long-term programs. However, Welcome Manor might be under the canopy of Minnesota Adult and Teen Challenge, but we are still licensed as Welcome Manor Family Services. And our focus is families. It is not faith-based. Right now, we don't even have a faith-based group running at Welcome Manor. So
Thank you. You know, it's like that's kind of the, Senator, go ahead. You want to follow up that?
Yeah, thank you. Thank you, Mr. Chair. And I appreciate that clarification. And so you said right now it's, it's under the umbrella of Adult and Teen Challenge Minnesota, who does say that their long-term recovery programs are faith-based, but that's not going to change at Welcome Manor.
Ms. Klabundi.
Mr. Chair, Senator, our clients will always have an option for a faith-based track if they choose that, but they must choose it. It's not required.
Thank you.
Senator Rasmusson, to that point.
Thank you, Mr. Chair. And I just wanted to state, I think for many Minnesotans, engaging with their faith and their it is really important and important for their recovery, important for their journey. And so I just would want to make sure that the takeaway from this committee hearing today would be to discourage faith-based treatment. I actually had a chance to visit a direct care and treatment facility recently that does really important work with Minnesotans who are civilly committed, and the medical director there told me one of the most successful indicators that they can see are individuals engaging with their religious faith, whatever that might be, there at the facility. And they have a chapel, and that's in a state-owned facility. And so I just wanted to say that, Minnesotans might have different paths. They might have different ways of engaging on this. But I just think for many Minnesotans, I know that having faith-based services can be really critical for their success. So thank you, Mr. Chair.
Thank you, and thank you, Ms. Klabundi. Senator Maye Quade, Senator Maye Quade.
No, thank you, Mr. Chair. And I think it's important to note that, yes, that is true for many Minnesotans.
Huge.
There's also a large populations of Minnesotans who are trying to enter into substance use disorder treatment and can't find non-faith-based ones, who might be, who part of their trauma is religion, who part of their journey is to heal from that, and or they just don't, feel like having that be part of their recovery, or it's not part of their life at all, and they don't intend it to be. And so that is a huge need that we hear from folks, is that, it needs to be appropriate for them, whether that is faith-based or not faith-based. I think one of the problems that we're seeing is that there's a saturation for folks of a specific type of treatment, and then it doesn't serve them, and then it ultimately isn't successful because it's treating a person that they aren't. And so we want to make sure that we're being really, really clear about what we're doing, when we're doing it, and who we're doing it for. And I think all paths are good paths, but we have some that are really closed down and inaccessible, particularly in rural Minnesota. Yeah,
that's good. Thank you, Senator, for the reminder. All paths, it's like, if I truly believe in all pathways to recovery, right, it's like, how are we doing that? And then we look at the data set, and I remember this conversation we've had throughout the years on specifically this program, that they have some of the best data that is out there, and when you look at it. And so I'm glad you asked the question, and we keep asking the question, how flexible is this overall program to the fact of the needs that individuals have come in? It sounds like you're committed to that. this is a gap that's needed. There's a second one, and I thought, Maye Quade, I thought you had another bill that addressed some of the pregnant moms in treatment and something, and maybe it wasn't you. Yeah, maybe it was you, but I'm saying there's another need for this, like in north central Minnesota. And so is that correct? Yeah, Maye Quade?
Thank you, Senator Hoffman.
Senator, yeah.
Or Mr. Chair. It could be that, so one of the things, the civil commitment process in Minnesota is it can be a barrier to people reporting that they have substance use disorder issues when they're pregnant, which is one of the best times actually to get people into treatment because they worry about losing the child they're pregnant with, the children they already have. And so removing that requirement allows people to be more candid and say, I'm struggling with this, I need help, and they're more likely to get into treatment instead of worrying about being civilly committed against their will for admitting that they have a problem.
Thank you.
I'd vote about that.
Thank you for this discussion. It's something we really deal with. It gets to the why we do what we do. So thank you for that. Senator Frentz, disposition of this, we're going to lay this over, so you get final 5 minutes to give us the speech, state of the state.
Mr. Chair, members, thank you for taking on this. I know you have a lot of important topics in front of you. I agreed to support this facility years ago, months ago. We talked about this funding gap, and it's been 2 or 3 months since I agreed to author this bill. So just give you some perspective on timing. Also want to add that this facility itself is in Senator Draheim's district, and yet it serves a population in the greater area. So he's a co-author on the bill, and for any other future co-authors, look forward to working with you with that, Mr. Chair and members. Appreciate your consideration. I know you have a lot of funding requests.
Just help us find the money, because, you know, and everybody's got looking at the pork chop sitting around our neck here in this committee, it doesn't help. And so this is the why we need to look at something like this. And so I appreciate you bringing this forward. And so that we're going to lay this over for possible inclusion after your former neighbor finds us some money. Thank you so much.
Thank you very much, Mr. Chair.
Oh, by the way,
members.
you're welcome. Did you ever see the movie Conclave?
I don't think I did.
Oh, ask that guy in the front row. Thank you. With that, members, Senate File 792, Senator Hauschild, come on up. I thought we had this conversation, Grant. Boundary Waters Care Center grant appropriation, if I remember right, Senator Rasmusson, and didn't we have last year, there was a series of one-offs in some of these small facilities? Was this, remember that? Is this different? I don't know. Talk to us.
Thank you, Chair Hoffman and members. To answer your question, Mr. Chair, yes, we have talked about the Boundary Waters Care Center many, many times. This is something that's very close to my heart. It's in the community of Ely. It's a critical access nursing home facility.
I got it.
And Mr. Adam Maslowski is also online. But what we're talking about today is this nursing home that provides nursing home beds in one of the most rural communities in my district, which is the most rural district in the state. And it's really critical that our seniors have the ability to stay in their local communities as they near end of life. The Boundary Waters Care Center has faced financial challenges, much like nursing homes all across the state. However, the Boundary Waters Care Center has had to do private fundraising in the community in order to keep its doors open. So they have been in very dire straits as recently as the last few years. And luckily, they did raise substantial funds from the community, as well as the nursing home aid that we did previously. And this is us coming back to really bring forward the struggles that this center faces and asking for an appropriation for this facility for $250,000, which is what the request was in 2023, which did not get funded, unfortunately, once it was in conference.
Yes, thank you, because that was, thank you so much. Thanks for clarifying that with me. So, and I know that when you park up there in Ely, the Blueberry Festival parking you pay, and I think proceeds were going to help the Boundary Waters Care Center. So Adam Maslowski, you're on Zoomerang. Welcome.
Thank you, Chair Hoffman. Thanks for giving me this opportunity to testify. So I'm Adam Maslowski, and I serve as the administrator for Boundary Waters Care Center in Ely, Minnesota. I've been here for a good 18 years in a variety of different roles. You know, as Senator Hauschild mentioned, we're a small skilled nursing facility. We're licensed for 42 beds, and we're truly at the end of the road. The next closest skilled nursing facilities are 50 miles away in several different directions. We're also one of the only independent nonprofit nursing homes left in the state that have no large corporate backing or safety net of any kind. Any funds that we would receive would go a long way towards stabilizing the facility's financial footing. In the legislative session 2 years ago, nursing homes across the state received a $12.35 per patient day rate add-on. This expired at the end of 2024, and Boundary Waters Care Center was impacted with a decrease in revenue of approximately $125,000. The Care Center also takes part in the Critical Access Nursing Funding Program, which provides an additional $400K in revenue per year on average. This designation ends on June 30th of this year with an ability to reapply, but no guarantees. There's also uncertainty when it comes to proposed nursing home worker minimum wage increases that have been proposed by the Nursing Home Workforce Standards Board. I've been assured that this will not go into effect without some upfront funding. However, projection models that I have seen on total costs of these increases have not taken into account union wage scales. These models have shown an impact of around $200,000 for our facility as an example, but when the increase in wages applied to our union wage scale and the different steps, the impact is more around $400,000. Just these three things not going our way would result in an over $900,000 swing in revenue and expense. We also have added costs relating to our location at the end of the road. Staffing continues to be an issue, with the facility continuing to rely on some agency staffing in order to meet our residents' needs. In 2024, the cost of the facility was $136,000. Additionally, many of our residents have surgery and other procedures in Duluth, which is 2 hours away, requiring transportation costs that can be $1,000 round trip. We also continue to see some delays in the county's ability to process Medicaid applications. This sometimes stretches as long as 6 months, and this is 6 months in which we are not paid for residents' care, bringing cash flow issues to the forefront. Beyond all this operational juggling that is required to keep a nursing home running in a rural setting such as ours, our building itself is aging and upgrades continue to be necessary. I recently received a quote for a project to replace the facility's water mains that came in at $355,000. This is a project that has to be done at some point because our building is nearly 60 years old. So whether funding received is used to help operate or to invest in the building, either way, it'll go a long way toward helping keep people that work their whole life in Ely in the community that they call home. So I appreciate you, Chair Hoffman, and I'm more than happy to answer any questions.
Thanks, Adam. Thank you. Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Senator Hauschild, for bringing this bill that I think highlights just some of the concerns of nursing homes across greater Minnesota, and sharing the story of Boundary Waters Care Center here today. Mr. Chair, I had a question for our testifier. From the governor's budget proposal, do you know how much funding you would lose or the impact that would have on your facility?
Mr. Maslowski.
Yes, thank you, Chair. We did receive a study specific to our facility that Leading Age helped us with, and over the course of 4 years, we would lose approximately $1 million in funding. It kind of wraps up each and every year.
Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Mr. Maslowski. And as a follow-up, Mr. Chair, to Mr. Maslowski, is that in addition to the costs that you talked about from the Nursing Home Workforce Standards Board?
Mr. Maslowski.
Yes, that's in addition to that.
Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Mr. Maslowski. And I would just, highlight that, as just a big concern too when we're looking at the governor's, proposing $1 million cut just for this facility over a 4-year period of time. We're talking about hundreds of thousands of dollars in unfunded or underfunded mandates, depending on who you talk to. And I just think, again, what we've seen coming out of the governor's budget, unfunded mandates coming from the Department of Labor and Industry through the Standards Board, I just think that's going to not only have a really negative impact on Boundary Waters Care Center, but on rural nursing homes across the state. And so I just think that's something that this committee needs to keep in mind, otherwise we're going to have a lot more issues on our hands if we don't address that. So thank you, Mr. Chair.
No, thank you, Senator Rasmusson, for bringing that and asking that question about the compounded the two systems there, because I remember this conversation last year, and the fact is, our committee, remember the last years, we funded CANF, the Critical Access Nursing Fund, and you know, when he said we're gonna have to reapply for that, that's great. So Senator Abler, to the points.
Well, thank you, Mr. Chair, and thanks for coming. I'm sorry we need this bill, but certainly if I had a gavel on the budget, this would be something I would be way considering. But Mr. Chair, I have a help me understand question.
I like that, Senator Abler. Help me understand questions.
I may have to attract a testifier to help me understand, so maybe Ms. Bailey could help me understand something, do you think, Mr. Chair?
You know, if Elise Bailey wants to, you know, come on down and answer a help me understand, I think that would be appropriate, because she probably forgets more in a day on spreadsheets than anybody.
Well, Mr. Chair, and there's no leaner department, agency in this state than DHS, and they have to justify why they come to these meetings. And so if they never get to talk, then pretty soon they'll be laying off fiscal manager people, and that would be Mr. Chair.
Thank you, Senator Abler. Ms. Bailey, to the good point.
Anyway, the reason I'm provoked by this, to talk about the standards board and the costs related to that, and just so I was actually an author of that, so I see merit in that. I'm glad there's some way to call attention to trying to retain workers in nursing homes and all of that, and I'm not going to get into the weeds on anything except I was told at one point that whatever they pass has to get paid for in the budget. And so, well, I'll ask you a couple questions. So the concerns that Mr. Mattson had, is there funding for what he talked about in the budget with what's been approved by the Nursing Standards Board, specific to his or whatever else they're passing these days?
Ms. Bailey, to that.
Chair Hoffman, Senator Abler, for the record, Elise Bailey, Budget Director at DHS. So it's a little bit complicated, and I'll try to summarize. Yes, you are correct in that any standards passed by the board, we have to do an analysis, and the analysis kind of looks at what is the standard and how it compares to what is in the current forecast, or what current wages would be paid, or whether it's wages or holiday pay, what is currently in the forecast. And so the standard board implemented or proposed two rules. One was on holiday pay, one was on a minimum wage standard, and we did two separate analyses as such. The holiday pay, we found, looking compared to the current forecast and the trends going up and what the impact would be to nursing homes, that the costs were already within the forecast, and therefore it was a zero, increase cost compared to what is currently booked in the forecast. That went into effect, therefore, on 1/1/25 this year. The minimum wages, though, we did do that analysis and found that there would be an increased cost to nursing homes. And so we have presented that in the governor's budget. Now, the complicating factor is, as the testifier stated, we also have the 2% cap in a separate proposal. And so how we're dealing with the interaction there is the amount that we would need to implement the standard is on top of that cap in that proposal. So it's like an add-on that we're proposing to include.
Senator Abler.
Well, thanks, Mr. Chair and Ms. Bailey. So I have a question beyond this one, but so if the governor's proposal on that element is not enacted, then the wage increases are not enacted. Is that correct?
Ms. Bailey.
Chair Hoffman, Senator Abler, that is correct. We need an appropriation by current law on the Workforce Standards Board and in order to implement any rule that requires an appropriation.
Mr. Chair.
Senator Abler.
And so if there's an interactive effect if the governor's entire proposal goes forward, you've covered the wage part, the extra wages due to the holiday pay, et cetera, would come out of the original forecast. If the governor's proposal to cap everything and do whatever the iterations of that are, go forward, then it's conceivable that the holiday pay would not be affordable to a nursing home. It's just sitting there doing their business, right?
Ms. Bailey.
Chair Hoffman,
no
Senator
money.
Abler, we have not done that analysis since, the governor's budget, 2% cap is a proposal, and the holiday pay is already in effect. And so we have not done any sort of analysis on the interactive effect between those two things.
Do you think it would be beneficial we need to, as we're looking at the full overall budget, when we get the budget language, Senator Abler, is this, how do you think we should proceed as a committee looking at this? Because I'm seeing the conflict that's happening in those two systems.
Well, Mr. Chair, I didn't know all the answer when I asked the questions, which is, some I know answers to, and then this one I didn't get it. So if the governor's proposal is enacted, then it may well be that Mr. Mattson's nursing home cannot afford the holiday pay, and putting a burden on them, which is the problem with actually going backwards in funding. My point of today is not to criticize the governor's proposal for funding, although I'm not a fan of it. But and so, Mr. Chair and Ms. Bailey, I appreciate and respect your math skills and the depth of all the stuff you have to keep track of, and frankly, I admire it a lot. There are people who do not work in your department who don't agree that those are funded in a way that makes sense. And so if a nursing home would live under whatever happens to them, the holiday pay, and then you decide, there's some money for the wages, and then they go out of business, did they really not go out of business because they went broke? Is that a good question, Mr. Chair?
Yeah, Senator Abler, I think it's, then the counter to that is, it's going to be put on the value-based reimbursement piece. Then you got to wait 20 up to 27 months to get your reimbursement side of it. So here you got the conflict piece, and I was doing fine with this conversation until you decided to bring in the past formula, and then
So,
this
Mr. Chair, there was a tombstone that I saw. It says, "I told you I was sick." Anyway. So I think just to encourage the department as they do their analyses to consider the situations of what's before us. And if we have to, we have a duty, it's an entitlement, is it, Mr. Chair, based upon some public law to get to go to a nursing home if you're.
It's 17, thank you for asking that question, Senator, but there are 17 Medicaid mandates that this state of Minnesota must do, and this is one of them, correct?
Thank you, Mr. Chair.
Thank you. Ms. Bailey, thank you for doing that. Senator, thank you, Senator. Senator Hauschild, I think we're laying this one over for possible inclusion, is correct? Unless you guys want to send this one to finance too? Is that a motion? All right.
Senator Hoffman, I'd be fine if we sent it straight to the floor. It's up to you, though.
Let's go to finance on this one, though. Roll call. Roll call. All right, we're going to lay this over. Thanks, Grant. I appreciate that.
Thank you.
Senator Zainab Mohamed. Grant, have you seen the movie Conclave?
No.
Okay, thank you. Zainab Mohamed, you got Sarah Grafstrom's, Sarah Grafstrom, Zania Harut, and ladies and gentlemen, former Commissioner Dan Pollock. Come on down. You want to get another chair out here for you, Dan? So you can, is Zania here? I don't see her. Oh, she's zooming it. All right, so you're good. Senator, the floor is yours. Tell us.
Mr. Chair and members, thank you for the opportunity to present my first ever bill in this committee. Senate File 1146 is a bill to reform the Section 245D conditional licensing process. First, I would like to adopt the A3 amendment, Mr. Chair, which is...
Amendments in front of you. All those in favor say aye. Aye. Opposed, same sign. Talk to us. We got one no up here, by the way.
Why do we need reforms for 245D disability services licensing? This committee is named the Human Services Committee. It should come as no surprise to us that in any complicated system involving humans, mistakes are inevitable. A very small number of those mistakes are serious, life-threatening concerns that require immediate action by our regulators. This bill makes no change to that. The vast majority of mistakes in our complicated human services license program are paperwork or minor filing errors equivalent to having a broken taillight on your car. We should not be bankrupting our small business providers, firing their employees, or declaring emergencies for minor mistakes. Too often, we are seeing the conditional license be used to paint a very broad brush, punishing providers with a 1 to 2 year penalty box, suspensions on new admissions with little opportunity for shortening or easing their punishments other than going to the court. This bill is about prioritizing and focusing the obviously limited resources of our regulators, people at DHS who we entrust to enforce the regulations that we put in statute. We want those regulators to be understanding, engaged with providers, and most importantly, to be collaborative. Collaborative is the formal method of safety system design that uses information sharing, and organizational transformation methods to correct mistakes in a complex system without blaming humans for their mistakes, but instead offers people multiple opportunities for safety, for improvements and corrections. Mr. Chair, I can go through the bill, or we can take questions.
You're on. Thank you, Senator. I know you're on a timeline. I was so excited to see this because we've been talking for years about we've got to get a technical assistance side to this thing on 245D because it's really complicated. And I just went down to the end of the table and I said, hey, Abler, you want to look at this because this is what we were talking about 10 years ago. And he smiled. He said, okay, that's what we were just talking about. So I'm excited to hear this. And if you know, you want to get, if you want to go into the weeds of this, you know, the time is yours. You can spend the next hour telling us all about this 245D thing, or since you want to get close to where you need to be because you've been, you know, I heard you loud and clear this afternoon. It's all up to you. If you want to just get to Sarah and Dan, who probably will do just as fine a job as you, then we're good.
Okay, well, the bill's in front of members. We'll go with Sarah and Dan, and then if folks need it, I can walk through the bill.
I love this idea.
So
Tell us about it. I appreciate you. Thank you. Sarah.
Thank you, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom, Senior Director of State and Federal Policy at ARM, and thank you for the opportunity to provide testimony in support of Senate File 1146 as amended. ARM represents over 200 residential service providers providing services to people through the 4 disability waivers licensed under 245A and regulated under 245D. Over the last year, we've been grateful for the opportunity to provide feedback and work in partnership on the language in Senate File 1146. Many of ARM's members have been providing services since the establishment of the waiver in Minnesota. Their staff have years of experience in understanding the rules and regulations that a provider must follow under 245A and 245D, and even with that experience, members often have questions about the meaning of certain regulations or what they should be doing to make sure they comply with an ever-changing regulatory landscape. Understanding these rules and regulations can be even more challenging for new providers or providers who speak English as a second language. The proposed requirement for licensing compliance education will equip new and existing license holders with clear and accessible resources to understand and maintain compliance with licensing requirements. This proactive approach will not only empower providers, but will foster a culture of transparency and accountability. Additionally, establishing initial compliance monitoring visits will play a pivotal role in supporting new license holders. By providing technical assistance during these visits, the state can help to ensure that providers begin with the necessary tools and guidance needed to successfully comply with licensing standards. Finally, we want to share our support for the establishment of a mediation process when the request for reconsideration of a correction order has been denied. Creating a mediation process gives providers an additional option outside of legal action when they feel like the correction order has been given in error. I want to conclude by saying that this legislation in no way is trying to limit the commissioner's ability to take action on violations. Instead, this legislation develops a system of support for providers to help them understand requirements from the beginning, helping mitigate or eliminate violations from occurring in the first place. And thank you for the time and opportunity to provide support for 1146.
Ms. Grafstrom, thank you so much. Members, I like this. I'm liking what I'm hearing so far. So Dan Pollock, don't screw this up. You're going to go to, you're going to Zanya? Zanya, thank you. Nice welcome back.
Thank you, Mr. Chair. I am at home because the school's canceled. So for the record, my name is Zania Harut, and I serve as the board chair of the Residential Providers Association of Minnesota, also known as RPAMN. RPAMN is a nonprofit trade association representing small, residential, and customized living as well as waiver services providers across Minnesota. The majority of our members are culturally specific service providers who deliver essential care to some of the state's most vulnerable populations. I appreciate the opportunity to speak in strong support of Senate File 1146, which takes critical steps to improve licensing fairness, compliance support, and regulatory transparency for HCBS providers under 245D. At its core, this bill is about ensuring high-quality care for Minnesotans with disabilities by clarifying compliance expectations, standardizing enforcement, and giving providers fair opportunities to correct issues before punitive measures disrupt services. One of the most pressing concerns among providers is the inconsistent and subjective nature of conditional licensing enforcement. Some providers receive severe penalties for minor paperwork errors, such as missing signatures, while others who fail to properly administer medications and maintain records face no conditional licensing consequences at all. This lack of uniformity creates an unpredictable system where providers are left guessing what enforcement actions they may face, depending on the licensor assigned to them. The absence of a clear, standardized enforcement framework results in providers shifting resources away from resident care to excessive documentation efforts, ultimately harming service quality. DHS does have existing sample policies, procedures, and forms, but many of them have not been updated for years, causing confusion for providers trying to follow outdated guidance. The 245D license is already complex, with requirements, deadlines, and compliance expectations spread across multiple sources, making it difficult for small providers, especially culturally specific providers, to navigate the system without dedicated compliance teams. When compliance expectations are unclear or contradictory, it does not improve care. It makes it harder for providers to actually meet the standards. This bill introduces several important reforms to ensure fairness and transparency in enforcement. It requires DHS to issue a warning before placing a provider on a conditional license, allowing them to correct deficiencies before facing severe penalties. It also provides a clear, uniform standard for enforcement to prevent discrepancies between licensors and ensures that all providers are treated fairly. Additionally, the bill also allows for the reduction of a conditional license's duration if a provider demonstrates compliance, creating an incentive for improvement rather than prolonged punishment. This bill also strengthens fairness in due process and licensing actions. A conditional license can be devastating for small providers, not because they refuse to comply, but because the system lacks clear pathways to compliance. Many providers rely on referrals from case managers, and a conditional license can immediately damage their reputation, even for minor infractions such as paperwork errors. The current reconsideration process is not meaningful, and it offers little opportunity to challenge correction orders. This bill introduces a mediation option for providers who lose a reconsideration request, giving them a fair and independent opportunity to resolve disputes before penalties take effect. This bill also requires DHS to publish annual reports on correction orders and conditional licenses that will bring much-needed transparency and accountability to enforcement trends. At the heart of this issue is the well-being of Minnesotans with disabilities. Providers in our network are deeply committed to delivering high-quality care, but outdated and inconsistent regulatory practices create unnecessary barriers to that mission. When enforcement is inconsistent and punitive, it does not improve care. Instead, it strains resources, discourages new providers from entering into the field, and it creates instability for the very residents who rely on these services. Thank you so much for your time.
Wow, thank you for your work on this. So, Senator, there was a Senator, David Tomassoni, and he used to say to the third person, now you've sold the vacuum cleaner to, I mean, you've done your job. So, Mr. Pollock, Thomasoni used to say that you've already sold us on this, right? And Senator Utke's going to ask, is there a fiscal? I already know that, so we're going to let him ask that one because that's what he asked, right? This is really good. This is stuff that we've been talking about. I thank you for bringing this, Senator. Wow, brand new to this committee. I'm like rocking it. So, Senator, Mr. Pollack, the kitchen sink has been sold. The house sign has got sold on the outside of it, so you've done your job. What can you say to not unsell it? So there you go. How's that? Did I say that right?
Mr. Chair, good bill, vote yes. I'm here for questions.
Thank you, Mr. Chair. Thank you, Senator Mohamed. I guess one question I have, Senator Mohamed, either for you or your testifiers, is there anything in this bill that DHS can't do today? Like, could they just decide that this was going to be their policy and this was going to be their approach? Do they need to have a bill to do this, or could they just decide that this is how they want to engage with providers?
Senator Mohamed?
Thank you, Senator Rasmusson. That's a really important question, and I know that the agency's here, so maybe they can answer that for themselves.
Whoa.
Somebody new.
Mr. Chair, more justifying of people's presence here. I appreciate that.
Yes, Senator Abler. It reminds me.
Mean, tight, really run agency.
To Senator Rasmusson's point, can you clearly state your name and what department, division, et cetera? And welcome to Human Services.
Thank you very much. My name is Alyssa Dotson, and I am the Licensing Division Director in the Office of Inspector General. There are components of this that certainly we can do without enacting law to that. I think we share a goal of wanting to have clear, concise, transparent regulations and education for providers in doing that. We do have resource limitations on some of the proponents to this that would require additional staff to be able to create trainings and education and get that information out there. Certainly in the way that we interact with providers, of course, we can always we always want to improve and make sure that we are being clear and transparent again, and that people understand and providers understand what those regulations are and what they need to do into compliance to come into that. So there's pieces of it, yes, but there's other pieces of it that we would need to have further discussions on and continue to work through with that.
Senator Rasmussen.
Thank you, Mr. Chair, and thank you for that answer. And I guess, if my feedback on this would be if DHS thinks that components of this bill are good ideas, and especially those that they can just implement, I would just recommend that they try to do it, I guess, instead of having to wait for a bill and an effective date and then, implementing it there. And but I appreciate the work that Senator Mohamed has done, and I know you incorporated a lot of feedback from the agency and the author's amendment. So that's all I had, Mr. Chair.
And I think, thank you, Senator, that's a good point. And I think that Dan Pollack and Sarah, you guys had worked with the department on this. We've been talking about this. I love technical assistance. As a matter of fact, 2 years ago, this committee funded for specifically in the 245D world, Somali, East Horn of Africa, it was there as that conversation because there was a deep need and understanding the implication, right, of 245D, and it's just like, it was in that light, and I don't know whatever happened to that, but I just know that this gets us to where you started this conversation, Jim, 8 years ago. So Senator Maye Quade, you too.
Oh, thank you, Mr. Chair. Senator Mohamed, I love your bill. Way to come in with a bang to the committee. I love it. And the thing I want to say too, I agree that if the department can do some of these things, they should. But one of the things that happens with disparities is that you don't see it in individual decision-making. It's individual decision-making when you see it all together. And so I don't think most people operate with the idea that they're doing something that's creating disparities, but when we look at all of it together, that's what happens. And so it helps to have a regulated system where the treatment is outlined, because that's how we make things fair. And I really like that it leans into the understanding that most of the things that happen where people are out of compliance are mistakes. Bureaucracies are hard to navigate, but that's also how we have accountability, so we can pick one or the other. And coming at it from a spirit of let's fix this instead of you're bad is a great way to operate forward, because then we can have less of that, right? Once you fix it, then and then you can continue forward. So I love this, and I think this is great.
I do too. Senator Abler.
Well, thanks. I'm trying to think of a question Mr. Pollock can answer just so he can justify his existence today.
Wait, Jim, it's just, wait a minute, you guys. It says, and I'm giving him a hard time, available for questions only.
he's
So
available.
if you want to do a question for
He's there,
him-
he's
Hey, wait,
available.
I got a question. Hey, Dan, did you ever see the movie Conclave?
No, Mr. Chair.
All right,
It's on
there
my
you go.
list.
So you're only 1 for 3 in this committee, so go ahead.
Anyway,
Senator.
so well, I appreciate the work on this, and to the OIG, we've put you in a difficult spot. And so the people that were snagged up on this stuff before were violators, and truly they were violating something. But there's the no hurt, no foul violators that really didn't mean to do something wrong, and then there's people who were just driving a truck through loopholes. And unfortunately, just given the pressure, sometimes you have to treat everybody the same because they're just, well, you're not following the rules. I'm glad there's a way to have an off-ramp for people that are sincerely trying to do their business. This seems to thread that needle, as I understand what you're telling me, that it streamlines it, Mr. Chair, I can't talk, it streamlines it or facilitates handling some of these more trivial things so that we can get more, so that people can provide services. Because we hear when somebody was denied something that is an unreasonable denial, then we hear about that. And then when somebody does something really bad, then you read about it in the paper. So you're just, the OIG gets nervous. I've been here since the inception of a lot of that. And so I appreciate this. And Mr. Pollock, would you, do you believe I've got this point correct?
Yes, Mr. Chair.
Is that a question to Mr. Pollock?
Thank you.
How do you want me to refer to, former assistant, former commish? What do you want to? You want to?
Chair, I don't believe in reincarnation except in government. You just never know what someone's going to become. And Mr. Pollock is a case in point. Thank you.
Mr. Pollock.
Mr. Chair, everything he said is accurate.
Thank you. So Elise, I suppose there's going to be, this is something that needs to happen because I can think of how many times I get the email or the phone call or the conversation and ask the staff, and everybody on this committee will tell you, and we end up going, why wasn't this handled locally by somebody, right? That, and I don't mean locally as in it's the city or the county, but locally meaning the licensure could have been providing some kind of supports to this. How many times that question has bubbled up, right? And how many times then I've quickly forwarded to that individual over there in the corner of this room, Christy Grom, who then gets inundated with those all the time, right, along everything else she's doing. She's doing the job of 4 people. I don't know if your commissioner's listening to this, or she's doing the job of 4 people. But we know that she then has to route those where if you had this system in place, that this just makes sense. I mean, when we did the reauthorization, sorry, Jim, 99-457 in 1997, it was about providing technical assistance to states on how they implement the changes from Part H to Part C. It was the TA that was most important because then when you get good TA, you had less compliance issues. So fiscal note, prioritize it for this committee. Elise Bailey, if there is one, why not? I mean, everybody's stealing money from Human Services anyway. We might as well just steal some more from you, right? It's just kind of, which, I'm sorry, Jim, but we make up 25% of the budget, yet in order, we're going to do 65% is coming out of us to go. I'm just having a hard time, and sorry I'm perseverating on that. I know you need to go, but it just brought me up because Elise Bailey one time said I had to pay for something, not once, not twice, but 3 times. And it was all because it was like 3 times in a row. And I said, do I have to pay for it the 3rd time? And she smiled and said, yes, you got to. So Dan and Jim first.
Well, Mr. Chair, is 62.5%, 2.5 times 25%?
Something like that.
Thank you. Just on doing the math.
Mr. Pollock.
Mr. Chair, I have a very controversial statement. The complexity of compliance relates to the cost of delivering the service.
Yeah, we hit it. You're onto something. Senator Mohamed, thank you so much for bringing this, long overdue. Anybody else want to say anything? Closing remarks, you just want, it's a good bill, let's lay it over for possible inclusion, or you want to go to finance with it?
We will lay it over for now, so we get a fiscal note. Thank you,
All
Mr.
right,
Chair.
with that, it's laid over. Thank you, Senator Mohamed. Nice job. This was fun. Senator Rasmusson and then Senator Maye Quade. You got, is Tyler in? Oh, there he is. You have certain disability waiver services, out-of-state billing permissible clarification. Looks like you got, is it an A1?
Thank you, Mr. Chair. I move the A1 amendment as an author's amendment.
Senator Rasmusson moves the A1 amendment. All those in favor say aye. Aye. Opposed? Same sign. It's all yours. Now the bill is in the form that you want.
Thank you, Mr. Chair. Thank you for the opportunity to present Senate File 1810. This is a bill that would correct an oversight in Minnesota's disability waiver plans and allow Minnesotans with disabilities to receive needed care and services while traveling out of state or attending an out-of-state post-secondary educational institution. This bill would allow individuals who receive night supervision and individualized home supports, or IHS, without training services, to continue receiving those services if the individual travels out of state for a temporary period. Currently, these two services stop at Minnesota's border, which directly impacts constituents in the district that I represent, which borders both North Dakota and South Dakota. Individuals who want to go to Fargo for a family visit or a doctor's visit are unable to do so without forfeiting their services for that out-of-state travel. It is important to note that the federal waiver plans already allow individuals to receive many direct care services while temporarily traveling out of state. This bill corrects an oversight for the two services that are not included. I also just want to say that this bill would only extend services outside of Minnesota for direct care assistance services that are already approved in an individual's service plan. In your packets, you'll see letters of support from ARM, Legal Aid, and the Disability Law Center, and other advocates who have been impacted by this. And Mr. Chair, would just say that this change would allow Minnesotans with disabilities the freedom to travel temporarily beyond Minnesota's borders without foregoing the assistance that they need. And with that, I would like to turn it over to my testifier.
Welcome to the committee. You can introduce yourself and you may begin your testimony.
Good afternoon, Chair and committee members. My name is Tyler Langenfeld. I live in Hastings, Minnesota, and I'm the Senior Director of 245D Services at ACRA, Minnesota's largest home care provider. Thank you for the opportunity to speak today in support of Senate File 1810. At ACRA, our mission is to improve lives by providing individualized home care services and support to people in their homes. We accomplish this mission by offering a variety of services, including individualized home supports, or IHS, without training, and night supervision services under our 245D license. At ACRA, we believe Senate File 1810 will correct a long overdue oversight and remove an unnecessary barrier for individuals who choose to receive their direct care services through one of these two services. On the surface, Senate File 1810 does a very simple thing. DHS has a list of services that are considered direct care staff services, and this bill would place IHS without training and night supervision on that list. This DHS list is important because only support staff working under an official direct care staff service can assist their clients beyond the borders of Minnesota. If your service is not on that list, then you cannot receive this support, and currently almost 1,000 ACRA clients and families are subject to this restriction. I cannot tell you how many times somebody has shared with me how excited and grateful they are to discover the many ways in which these programs are going to completely change how they experience life and explore their communities. Unfortunately, sometimes that same excitement quickly turns to confusion when the reality of this particular restriction is explained. Sure, you can visit your sister who is 25 miles away, but not if 25 miles away for you happens to be Superior, Wisconsin. Support staff can absolutely help you get to your friend's wedding, unless it's across the river in Hudson. To be clear, removing this restriction would only bring these two services in line with the rules and regulations regarding temporary travel that other direct care services like PCA and CDCS. Also, just like those services, if someone decided to visit Fargo, the hours they would use would be the same hours they would have used in Moorhead. These are not extra or specially approved hours. Everything comes out of the same already approved state-issued service agreement. Senate File 1810 understands that direct care is direct care. And if we are going to have a list of direct care staff services, then it needs to be a correct one, especially if not being listed translates into a huge and completely unnecessary obstacle for individuals and families who are just asking for the same level of access to their communities as others who require similar care. There are countless reasons why an individual might briefly be outside the state of Minnesota, and that is what this bill is all about. It is about maintaining friendships, seeing family, attending weddings and funerals, scheduling appointments, and yes, maybe even a well-deserved overnight in Wisconsin Dells. Senate File 1810 will finally correct this oversight, and as a result, ACRA strongly supports it, and I thank you again for the opportunity to speak on its behalf.
Thank you so much for your testimony. Members, questions? Well, after a lively discussion, Senator Rasmusson, I don't know if this will happen, but we should lay this over for possible inclusion and see if we can do some TA and bring it into line with all the feedback from today. Would you like to make closing comments about your bill? Okay.
Thank you. It's like the air changed in here. Now I'm just like I had to go, but that was good. Senator Maye Quade, you're up next. You're the next contestant on the Committee of Human Services. I should ask Matt Freeman if he's seen the movie Conclave. Senate File 1479, Maye Quade, Direct Care and Treatment Executive Board Appropriation for planning a build-out of a locked psychiatric residential treatment facility. I got Carrie and Dan. Are they going to join us or not? No? Are they online? Carrie Briones? No? Oh, they're in the back? Where are they? Oh, available for questions. I'm sorry. Go ahead, Senator Maye Quade. It's all yours.
Thank you, Mr. Chair, members. This is really a reappropriation. Last year, we appropriated $1 million to PRTF grants, and this bill would reallocate $100,000 of that $1 million to the build-out planning.
Okay.
The bill also requires that by March 1st, 2026, the executive board must provide a report to the legislature on the proposal for the build-out that includes the risks and benefits of the proposed location and the estimated cost for the build-out and maintenance. Right now, minors are not receiving the appropriate behavioral health care in the right place and at the right time due to limited access in Minnesota to psychiatric residential treatment facilities. Direct Care and Treatment currently provides hospital, group home, and crisis services for children, but not residential treatment, and that's creating a backlog that requires placing children in out-of-state facilities, which we got a report about. This bill will ensure that DCT will have the resources to connect children to the care that they need, and thank you so much for hearing this bill. It does not cost any money.
I just said that. That was last year. Senator Rasmusson, and then I think Senator Wickland might have a comment on that, but thank you, Senator Rasmusson.
Thank you, Mr. Chair. Thank you, Senator Maye Quade. Is there a specific program that you have in mind with this, or a specific facility, or anything in particular that you think this money will end up going to?
Senator Maye Quade.
Oh, my microphone's already on. Mr. Chair, Senator Rasmusson, the board is to plan a build out, and they're supposed to kind of figure out where are some locations, where could they be, what would be the pros, cons, risks, benefits, how much will it cost? And so this is essentially like the pre-planning, I guess. It's a pre-appropriation.
Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Senator Maye Quade. And I am grateful that you brought, this bill to talk about just like the capacity constraints that we have at Direct Care and Treatment. Is as a follow-up, could this be potentially an expansion at an existing facility, or would this have to be a standalone facility, or is it open to considering both?
Senator Maye Quade.
Well, thank you, Mr. Chair, and I might phone a friend, but I think it's the language has it pretty open. It looks at where it could be, what could be the cost, maintaining it, and what we could get from Minnesota Care medical assistance and private insurance payments. So
I think we got somebody from Direct Care and Treatment here, because the other question on top of that was like, there's a need for this in Clay County. You know where Clay County is? It's in Moorhead, right? The Twin Cities of Moorhead, Fargo, and there's a need. And I'm just so, it's like, this is good. It's doing it. So for the record, please state your name and your purpose.
Thank you, Mr. Chair. My name is Wade Brost. I'm one of the executive directors of Direct Care and Treatment.
Wow. Welcome back to our committee. We met you last year, so go ahead.
So the question, if I recall correctly, is could we expand an existing facility? Right now, we currently don't operate any psychiatric residential treatment facilities, so we wouldn't be able to expand one of those, but we could look at existing footprints and expand off of them if it's compliant with legal and regulation, which would be part of the initial review.
Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Senator Maye Quade, and appreciate that answer. I guess, yeah, the only thing I'd add is I do know that Clay County has indicated interest in having some type of facility like this, and that could really provide some good services for people across the state. And I guess, Mr. Chair, a follow-up question for direct care and treatment would be: is this something that could be a part of that work that Clay County is doing to try to have a facility up there specifically for children?
Mr. Brost, right? Is it Brost, B-R-O-S-T, is that correct?
That's correct.
Mr. Brost?
Mr. Chair, Senator Rasmusson, I think that's exactly what this review would be. It'd be looking at where in the state to build out, what are the pros and cons for the geographic areas, workforce availability, cost to operate in specific areas, et cetera.
That's good, Senator Rasmusson. That's a great question.
Thank you, Mr. Chair, and
Yeah.
thank you. Appreciate that. And yeah, I think this is great and something we have to be thinking about because there's obviously a need and it takes time to get capacity up and running. And so we have to, I think, move with some urgency to get that work done. So thank you for hearing the bill today, Mr. Chair.
Thank you, Senator McQuaid, for doing that. Senator Abler.
Hi, welcome back, Mr. Brost. I haven't seen you for a while, so. Actually, you might ask him about that commissioner thing, Senator Rasmussen, maybe not. You missed an opportunity. So a couple things. One, Mr. Chair, and to the world, this is actually the beginning of a good exercise, Mr. Chair, as we talk about our budget. It's maybe an underused pot of money, and we're going to repurpose it. I think going forward in the same exercise, instead of making it, $1 million to $900,000 and spending $100,000. In the exercise, you'd make it like $800,000 and spend $100,000 and let $100,000 go toward our target. So we need to do a lot of things like this. It's just a good practice. At least it's something, everybody else has spent more money. So this is the first one that takes money and reuses it, so there's no net increase.
Thank you, Senator, for bringing that up. And I believe a couple of weeks ago, Senator Maye Quade started bringing up some of that. And then Senator Utke said, with his return to sender comment, he said, deep down, there's some money, unspent money in some spots there. So you're reminding us our homework should be having Miss Bailey maybe, it's not up for her to do that, but it's like,
anyway, that's my first comment.
Yeah, go ahead, Mr. Senator.
The second is, we had quite a discussion about the 48-hour rule, Mr. Brost, and you're fully aware of that, and talk about tearing down the Miller building and putting up another 50. And I'm still curious that building is not valuable for something. And in a time, so I've been actually, remember the pictures I draw of the jail and then AMRTC and then the little one-story places with windows and a flower and then the group homes and then individual housing. I think that this is just tangentially related to that. And I think, Mr. Chair, maybe the vision should be crafted here to help the state with its issues. And Mr. Brost is certainly a key part of that with his experience. And I don't know if he has a lot of responsibilities. I would not want your job. But it's good you're here today because we need 350 beds or something. Yeah. And we're building, 20. And so since you're here, I'm going to chat. We got a second. So I'm inquiring about this. Department of Corrections is sunsetting jails because they're old and creaky. Are they junk? I don't know. But we're requiring, Wright County is spending $300 million. Bemidji is spending $70 million with a sales tax. And in a world where there's much less money laying around, we were told by the counties, Mr. Chair, that $460 million was a prohibitive amount of money. And Anoka County is looking at laying $250 million on its taxpayers just for a jail. And like, holy cow, there must be a better way as we can, maybe I'll vision with you a little bit just to help get a plan. Because, and it's not your fault, Mr. Brost. You're just trying to run all the operations. And if you sleep at night, I'm happy for you. But I I think that we just need to think about this, and how can we use a building that might be there? And to that, I have a question for Mr. Brost. Is that St. Cloud campus still there with there was a number of twin homes there, maybe 36 beds on the river, which was the scene of a former crime, but they were vacant when I looked up there 5 years ago or something. Are those been surplus, or are those still sitting around mothballed?
Mr. Brost?
Mr. Chair, Senator Abler, do you mean St. Cloud or Cambridge?
I mean, Cambridge, I didn't mean, I meant Cambridge.
That was, I worked at the Meadow, yes.
Yeah, no,
yes.
but so the Meadow building,
Yep,
and so
yep.
I misspoke.
There's a bunch up there. There's
Are they still are they surplus, or are they sitting up there?
Mr. Brost? Great
Mr.
question.
Chair, Senator Abler, I'd have to get that information, get back to you. I actually don't recall about that specific part of our business. Sorry.
All right, well, Mr. Chair,
Senator
anyway,
Ayler.
so,
Yeah.
you know, the whole NIMBY thing, they're
Yep.
already there.
Yeah.
With all respect to the Cambridge people. It's a gorgeous campus. They're twin homes. They could easily be set up for 1 or 2 people per side. If nothing else, it could be 36 units. I think it's 36 units. There's 18 twin homes, as I recall. They're already built.
Plus the old buildings themselves were when the Jensen settlement, that the individual lived in one of in the building, and there's fence still, that the old
yeah.
fence was still, it's a big campus. No, I
I just remember they were
Yeah, yeah.
relatively modern twin homes, and never mind whatever else is up there. But
okay, just the twin homes is what you're talking about. So could
Yeah.
you, might as well get an overview, can maybe.
Well, I don't know. I don't want to have to tour it again, but no, don't make me go. But I'm just, we're in a world of hurt, Mr. Chair. We need 350 beds.
Yes.
Jim Stewart, I've been talking to all kinds of Anoka County people about this, and Jim Stewart said half, maybe at least a quarter of the people in jails don't belong there. They belong on a 48-hour thing. And so if Anoka is going to build a new jail for an X amount of beds, but a quarter of them are for the wrong people, why are we building those extra beds? Let's put them into another thing. The jailers still have to watch all those people, and not that it's exactly the same money, but if a county is being forced by DOC to mothball a building that could be upgraded for a fraction of building a new one, and it's adequate, and the courtrooms are still adequate, and we're not serving 350 people,
No, I'm with you.
I wanted to express that again, and Senator Maye Quade was excited when I drew the picture, and so I'm just adding on with her bill with some of the visioning, excitement, which you're bringing forward a bit of that with your proposal.
And you know, to that point.
Thank you.
To that point, Senator Abler, Clay County, if you go up to Clay County, and they had an old hospital that is now, you know, it's multiple uses, and then they got youth, and they're actually, some of these youth that don't have a place to go after high school and after, I mean, it's really a great system they put up there, and it's because it's regional. There's everybody around them for many miles, and to that point, they just reused an old hospital that was there, and I was pretty impressed. And they're the need, to Senator Maye Quade, there's a need for a PRTF up there too, so that's why this is a good bill that gets us going there. So, Mr. Brost, if you could, it sounds like Senator Abler, we would be interested in finding out the disposition of the property of the Meadow campus, right? And so the last time I was up there I helped do discovery on a certain case. And so, Senator Abler.
Mr. Chair, and just because, and actually, because something really bad happened there doesn't mean that the buildings aren't useful for something very beneficial. So I think they've been kind of stigmatized by all that, and people have been afraid to touch them.
Yes.
I think that's been part of it. So, but I think I was not a child of the Depression. My parents were. That was a use it up, wear it out, make it do. And so the heart of a program isn't the building, it's the programming in the building.
Correct.
I mean, you need a decent building, but anyway, thank you. I'm done.
No, I'm glad you brought that up.
Thank you, Senator
So-
Maye Quade, for provoking the conversation, and Mr. Bros.
I think, Senator Maye Quade, this bill, we were originally going to lay it over, but because of the disposition of it, needs to go to Senator Wickland's committee, right? So, she's smiling, yes. Anybody else want to? Yes, everybody's going. So, Senator Maye Quade, Senate File 1479 to be passed and re-referred to Health and Human Services. Is that your motion?
That's my motion.
So be it. All those in favor say aye.
Aye.
Opposed, same sign. Thank you. Senator Maye Quade, thank you. Members, as we look at getting to our, since they got the deadlines, there's still a lot of stuff we're waiting on, you know, and we're back to where we were having that what-if question, right? And I know, Senator Rasmusson, I think you have some bills waiting to come from the reviser. So having said that, there's going to be we got a lot of bills next week. So would you, members, be interested in extending late committee times to maybe 5:30 or 6 o'clock, maybe the next 2 Mondays? Would that work for people here? Or do you want me to pick another day where we can all, like a Saturday? And
I like Sunday, Mr. Chair. The
Sunday
afternoon,
works.
Spend the whole time together, and
I think
we could have
so.
like little tea.
Yeah, I remember those days. Adki, don't you remember those days? Usually.
Mr. Chair, Monday is better. Monday is better, I think.
Monday's better?
Because we have caucus on, well, we have caucus too, but whatever, just. do
You
the
guys
best.
okay? Are you guys good Mondays? David?
I don't know. Jordan,
Jordan?
is that going to scoop our
You
caucus?
and Maye Quade okay on Mondays? If we go a little later? Everybody okay with that?
Maybe if we just
Works?
talk less.
I got a yes from
Maybe
people.
if Zainab talks less, it would move it along better.
Oh, so.
She never talks.
I'm not gonna, well, if we all commit to staying focused and not ask a billion questions, and I'm sorry, I will give the gavel to Erin Maye Quade will have the gavel going out, and because she'll just go bam, 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 and then everybody gets 2 questions. What do you mean I get 2 questions? That's sad that she's picking on me. I don't even care. Senator Wickland, we're good with that. Senator Udke, you're good? Monday works? I'm getting yeses from everybody. With that, anything else anybody want to bring up? No? Nice job today, folks. We are adjourned.